topic of hepatitis D. So the main objective that I would like to cover during my presentation would be the hepatitis D, its definition, background information, causes, risk factors, exams and tests, symptoms, treatments and preventions, experiment results, and my acknowledgments. So, what is hepatitis D? Well, hepatitis D was first reported as a nuclear antigen in the year of 1970. It was then discovered by an Italian doctor by the name of Dr. Mario Rizzetto in the year of 1977. Scientists have categorized this disease as a subviral satellite, which means that it is able to complete its whole entire life cycle and propagate in the presence of another helpervirus, which is caused by hepatitis B. The helpervirus theory. It was said to be that hepatitis B antigen was where the name delta antigen came into place. The disease was being discovered in patients that had severe liver disease. Background information continued. So, the infections that are related to the hepatitis D virus are co-infection is when you are being diagnosed or infected with hepatitis B and hepatitis D at the same time, and superinfection when you are diagnosed with hepatitis B and infected with it, and later comes into place with hepatitis D. Causes. It is only found in people that have been infected with the hepatitis B virus, and it is possible to worsen liver disease. So, as you can see here, you have the hepatitis delta virus, and you can see that the antigen strand is coming in the RNA strand, and around it is the hepatitis B antigen, which is known as the helpervirus. And here shows an electron microscope showing the hepatitis delta virus. The risk factors. So, pregnancy. A mother that is infected with the hepatitis delta virus, also known as HDV, is possible to pass the virus to their offspring and or baby. Hepatitis B virus is usually when you are infected with it, because when you are infected with the hepatitis B virus, later on in your life you will be infected or diagnosed with hepatitis D. Abusing intravenous or needles. So there are mainly people who abuse intravenous or needles, which means that they inject the needle into the vein with usually not cleaning it. Other risk factors can include not having protected sex, by not having the correct use of condoms or such. Other risk factors can include healthcare and public safety workers, where they can also come in contact with the infected blood. However, it cannot be spread through casual contact, such as the shaking of the hand or saying hello, and it can also you cannot also receive the disease by respiratory secretions, which can be also known as a cough or sneeze. So, some symptoms would include jaundice, fatigue, darkening of the urine, nausea, vomiting, confusion, pruritus, abdominal pain, and fever, and also loss of appetite. Now, jaundice is the yellowing of the skin and or eyes, and pruritus is the severe itching of the skin. Now, the question for this slide would be, how soon do symptoms appear? For co-infection, symptoms can appear from 45 days to 160 days, but the average is usually 90 days. For superinfection, they usually appears from 2 to 8 weeks. So some exams and tests that I have here is the anti-delta agent antibody, which is a simple blood test, a liver biopsy, which is the biopsy that is done through the abdominal wall where a needle is being inserted into the liver. As you can see here, this is the needle that is being used for liver biopsy. The liver enzymes is another simple blood test. Treatment and preventions. So the interferon therapy. This therapy is really good because it is possible to receive it. You are only possible to receive it for only up to 12 months if being infected with the long-term hepatitis delta virus infection. The interferon interferon therapy can prevent the disease from spreading to healthier cells and can also kill off cancerous cells. Liver transplant. Liver transplant is usually required when you find out that your liver is starting to fail. Preventions are as follows. Prompt diagnosis and treatments, avoiding intravenous drug abuse and sharing needles, hepatitis B vaccination, and that is all. Now, the prices for these therapies and medications can vary, but for the interferon therapy, it is approximately $40, and for the average price for the liver biopsy, it is $433, but the price for a blood test can vary. Experiment and information. So 228 of the hepatitis B antigen positive serum by the enzyme-linked immunoabsorbent assay were then received by the Genome Center. All sera was then stored into aliquots at a temperature of -70 degrees Celsius until used as a nucleic acid isolation. In a total, there was 190 patients that were split into groups based on sex. The males were then categorized for 121, while the female was 69. The mean age was 42 years with the chronic hepatitis B infection were also included in the data analysis. Methods continued. The hepatitis B DNA extraction and real-time PCR amplification. This, in other words, means that the hepatitis B DNA extraction, along with the amplification of the polymerase chain reaction, was able to help identify the hepatitis B virus. The extraction of hepatitis D virus RNA and its complementary DNA synthesis. The RNA of the hepatitis D virus was extracted and was turned into complementary DNA. Statistical analysis. Every single piece of recorded data was included and analyzed. My results. So the result for this section was to talk about the total amount of people, which was 288 of the consecutive hepatitis B antigen positive patients. Only 98 patient samples were excluded for the study because they were not able to meet the criteria for the study or due to the volume of the serum. After reviewing the data, the results came to be that only 67.3%, which were males, were considered as enrolled patients, while 36.3% females were also inserted as enrolled patients. So, hepatitis D around the world. So as you can see, we have a low prevalence of hepatitis D in North America, South America, Africa, and some parts of Europe and Asia, and Pacific Islands. The reason why is because Africa and those other countries that I have recently just named was that they are known as developing countries, and their cleaning techniques aren't really that good. And they also can't afford some of the therapies. So, genotype locations for hepatitis D. So the genotype 1 and genotype 3 is located in South America. As for genotype 1 is located in North America, along with some parts of Eurasia and some parts of the Pacific Islands. Genotype 2 and 3 are good because that way it shows that the treatments might be able to work faster. My conclusion and future research is that the future research will be to create a vaccine that will be able to fight off the disease permanently and to spread the word and create plans for each and every country about hepatitis D. So in conclusion, hepatitis D can affect us in many ways. It can be found in many places of the world and along with its genotype. There are ways to prevent and treat the symptoms for this disease. And these are my references and my acknowledgments. I would like to thank my mom, my dad, God, Dr. Nib, Dr. Williams, Dia, Stephanie, and Bria, my health, and my classmates, Ms. Lau, and my family members. Thank you. I now open to any questions, comments, or constructive criticism.
You know if this is a positive or negative thing inspired?
Pardon me?
You know if this is a positive or negative thing inspired?
I can't hear you.
You know if this is a positive or a negative thing inspired?
Wait, what was the last word you said?
Virus.
Fires? Judah?
Did you say you can only get hepatitis D if you had contracted hepatitis B before?
Yeah.
And if you get like a bad like blood transfusion, you couldn't get hepatitis D if you never had B before, right? Okay.
Tucson?
What did you mean by genotype 2?
So far I have not covered that information in the research, but I promise I'll get back to you. Andrew?
What is a nuclear antigen?
So a nuclear antigen is basically it was like back then it was kind of used for nuclear weapons, I believe. I think that's what my research were covering. Any other questions? Sydney.
What's an aliquot?
So if you'll just give me a second, I can pull up the word for you in my flashcard. So an aliquot is constituting a sample. Any other questions? Oh, Ms. Loud?
You mentioned on your methods section of your experiment a process where you took the hepatitis D virus RNA and you turned it into complementary DNA synthesis. Do you know what that process is called?
No, because the research that I was doing for this method did not go into that much detail of it.
Okay, so can you think about things that you've learned in your science class? You guys, I think, well, the 8th graders learned this, and you guys might have learned this too. Any procedure that you learned that took RNA and turned it into DNA and then amplified it?
Well, the polymerase chain reaction.
And then there's like those. So there's the PCR, and then there's 2 letters before it. What do they stand for?
Are you talking about tag DNA?
So tag DNA is in the one of the ingredients in the process in the experiment. But what are the 2 letters before PCR?
I'm not sure we covered that in science class.
Okay, it's RT-PCR. Did you cover that? Oh, sorry guys. But I guess it was the 8th graders who covered that. Okay, never mind. Okay, then I have another question. That's not as hard. What was the purpose of the experiment? Like, what was the conclusion? Like, what did they get out of this experiment?
So what they got out of this experiment, let's go back to the results section. Okay, so what they got out of this experiment was that from the people that they have tested with the hepatitis B infection, they got that at least 67.3% of the males were then infected with the hepatitis B, while it decreased down to 36.3% of females which got the hepatitis D.
So overall, if you could sum up in like one sentence, what does this mean for hepatitis B?
Overall, it says that even if you try to like have contact with hepatitis E, you'd always, in order for that to happen, you'd always have to be diagnosed or infected with hepatitis B. Niall?
If you get hepatitis B, is there an automatic 100% chance that you'll get hepatitis B?
Yes. cycle. And with hepatitis B, then there's always a 100% chance that you will be able to get hepatitis B as a super infection and or a co-infection. Sydney?
Do you know how many people each year are infected with hepatitis C?
No, my research has not covered that, but I'll get back to you.
Any more questions?